Hi, I'm Tyler Prier, and I'll be running a rehabilitation program today for Eric, who has undergone a grade 2 quadriceps strain injury. This injury involves moderate loss in range of motion in knee extension and hip flexion in active and passive motion. A moderate to severe muscle weakness is evident and is associated with a 25 to 85% decrease in strength, which is typical of this injury. Today I'll be going through initial and progressive rehabilitation exercises to improve range of motion and flexibility with stretching, maintaining proprioception, and increase in strength. Chair stretch. Patient will place foot on chair that is positioned behind the injured leg, which is the left leg. Patient will bend uninjured leg until light stretch is felt in the injured leg. Patient will perform 3 sets, 10 reps, holding each rep for controlled 1 second pause. Should be performed with light intensity. Progression. As patient becomes more flexible, raise chair height and have more knee bend on uninjured leg. Sideways stretch. Patient will lie down in fetal position with uninjured leg, the right leg, on the ground. Patient will keep uninjured leg close to chest while grabbing injured leg at ankle to pull leg behind body. Patient should perform a light stretch, 3 sets at 15-second hold for each with light intensity. Progression. Once more flexible, instruct patient to straighten uninjured leg on ground and then perform the same stretch as before. Lunge stretch. Patient will get into a lunge position with injured leg on ground. Patient will keep chest up and uninjured leg at 90 degrees. Patient will slowly bring hips forward and stop when a light stretch is felt. Patient will repeat this stretch for 3 sets, holding for 10 seconds each time. Progression. As patient becomes more flexible, the leg on ground can be put into a different position by placing a pillow under the ankle. As progression continues, the foot can then be placed on a chair, leading to higher elevation and more stretch in the injured leg. Bosu ball stand. Instruct patient to stand on Bosu ball with both legs and keep balance for 20 seconds for 3 sets with no to minimal pain experienced. Progression. Keep patient on Bosu ball and give him a light weighted ball. Instruct patient to keep ball straight out in front of them and tell them to move it left and right while keeping balance. Once patient is good with that, allow them to try standing on Bosu ball with 1 leg, keeping balance and no pain experience. PNF stretch. Lie down on stomach, hands at side, feet straight, and the patient will then bring the injured heel towards the body until maximum range of motion is met. Once he's at this position, I will instruct him to bring this leg back to rest position while I resist him. Patient should not feel much pain at all with little resistance. It's an 8-second hold for 4 sets and repeat with both legs. As patient becomes more flexible, I will assist him by bringing the leg towards the body. I'm going to lift the thigh off the ground and then resist as the same I did before. Step up. Patient will bring foot to top of obstacle in front of him. Patient will then alternate legs and perform 10 reps per leg for 3 sets at a light intensity. Progression. Have patient perform same exercise but use a large obstacle so we have to lift leg higher. As patient becomes more comfortable and with the height of the chair, they can step up a lot faster. Extension. Patient will be seated with legs hanging off of edge. Patient will fully extend leg to reach full range of motion. Perform 10 reps per leg, 3 sets, light intensity, and no pain should be felt. Patient can perform the same exercise with a resistance band to strengthen the quadriceps muscles. Patient will perform squats starting at low depth. Perform 10 reps for 3 sets at light intensity with no pain experienced. Progression. Patient can begin to squat at a higher depth, which is getting lower, to increase range of motion. Once patient has full range of motion, they can implement weight to strengthen quadriceps even further. Lunge. Patient will separate legs into lunge position and perform a stationary lunge. Perform 10 reps for 3 sets per leg at light intensity and no pain felt. Progression. Allow patient to begin to perform walking lunges. Once comfortable and further progressed, allow patient to use weight to strengthen quadriceps even further.